Hi, Dr. Lisa Goins, Nurse Practitioner, Couture Healthcare Limited. I've accepted the Ice Bucket Challenge for ALS, and I wanted to bring some information to you about the ALS. I would like to thank Marnie for nominating me for this challenge. And I want to talk a little bit about the ALS webpage, where you can find a lot of information, like I have, on ALS. So a lot of people are doing the Water Bucket Challenge, and some of us don't really understand what that all means. ALS helps support people with ALS with a $25 million budget. They have raised over $100 million for this year. What they do is take that money and a lot of that money goes to help support people that survive ALS. The survival rate for ALS is between 3 to 5 years. Some people live a little bit longer, an extra 5, 10 years, but it is a disease where the muscles atrophy, and you will notice numbness in your hands, numbness in your feet, and then eventually your organs are not going to be able to function to where you cannot breathe for yourself, and eventually you'll be on a ventilator to breathe. This is one of the reasons why the Ice Bucket Challenge is so important. It's to give you an idea of what it's like to have ALS. That instant shock when the cold water hits you, you can't do anything, and that's exactly what an ALS person experiences. Now, ALS also helps with their public policy. They do a 24-month Medicare waiver. They have a national ALS registry, and they also have veterans benefits. Some of the symptoms that you're going to experience with ALS, and I have lots of information here that I'd like to share, is the muscle weakness, twitching, impairment of the arms, the thick speech, and also shortness of breathing and swallowing. If you wish to diagnose ALS, what you're going to have to do is you're going to have to put pins and needles in your body and stimulate the nerves, and this is called an EMG. Those people that have had it say that it's painful. That's the good thing. If you feel the pain, your nerves are working. If you don't feel the pain, not working. The other thing is a spinal tap, very painful, has some side effects of its own for the test. X-ray imaging, you're looking at the bones in the spine and looking at the muscle and the atrophy. Also a neurological exam. Doing cranial checks is one way to find out if you have any symptoms of the nerve problems that are related to ALS. Now the ALS Water Bucket Challenge goes down, the money is divided up through research, patient and community services, and public and professional awareness and education. ALS Water Bucket Challenge is on Facebook, YouTube, all the social media. One of the reasons it's out there is to help raise awareness of this disease. Thank you to everybody who has donated. I am not going to challenge anybody to do the ALS. I would like you to share the video and enjoy, because I am also going to give ALS, where is it at here, a check, and I'm going to hand these papers off, and then I'm also going to show you exactly what it's like for a person to experience what the Water Bucket Challenge is supposed to represent. And I'm going to try to not move, because ALS people who are in the last stages cannot move, they cannot speak, and they can't scream unless the ventilator's breathing air across the vocal cords, and even then it's not possible. So with half the neighborhood watching here in my area. This is for ALS. Please support. Thank you. And that's what it's like to have ALS. Thank you.